Oh.
Yeah. Right. Like this.
Yeah, I just figured out.
Good evening, everyone. Welcome you to tonight's town board meeting. For those watching at home, hope you're staying warm and dry. But we'd like to start the meeting. I'm sorry, it's a workshop meeting. We'd like to start with the Pledge of Allegiance, if we may. Thank you. I pledge
Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you very much. All right, first part of the meeting is a public comment session regarding topics on tonight's agenda only. Since this is a workshop meeting, we just ask you to restrict your comments to that. Is there anyone cares to go on? Okay. Then please.
Ken Gibson. I live on Riker Farm Road. I own a Riker Farm. And the only comment I want to make is we got one hell of an employee right here. I really want to compliment DJ for, it's kind of a crazy road. I want to just compliment you big time, the way you and your guys take care of the roads here. So personally, I appreciate what you're doing very much. That's
Well
it.
deserved. Thank you very much. Appreciate it. Lee, please.
Lee King, I'll say Riker Farm Road. Okay. I'd like to make an announcement this evening that with regard to our workshop meeting on the ambulance service, it was a tremendous meeting that we had on February 20th at the firehouse. Thank the fire company for hosting that. And in a response and a follow-on to that, I have requested a documentary filmmaker from New York City, Mr. Billy Chen, who is a colleague of mine. He is doing some work in this area. I asked him if he would please begin the documentary process by capturing some of the real foundation material. I think what you're going to do this evening when you discuss the restoration of the ambulance service is a very, very good step in the right direction. And I think that in the future, with getting information out to the public, what Mr. Chen might very well be capturing this evening could be very instrumental. So I wanted to make that announcement that that's what I have requested him to do, and that there is no such a thing going on here as our trying to catch some kind of a gotcha moment. Fair enough? Thank you.
Anything from?
No, it's a public meeting.
So if you don't mind, and I think that there will be no real disruption, I would like to ask Mr. Chen to choose an appropriate area where he can set up and capture the contents of the meeting, and I would like to be able to speak later.
Board feelings?
It's a public meeting, so.
Okay. All right, thank you very
But you're
much.
taped anyway.
And, but I just thought it'd be brought to ask legal and ask the board. Please, if you would, we appreciate it very much. GPI, would make their presentation from Board of Records Forum. We thank you very much.
Good afternoon. My name is Sherry Kern. I'm a structural engineer with GPI. GPI is an engineering consulting firm out of Albany. For the board members tonight, I prepared you guys some plans.
Thank you very much.
Thank you.
I do. Yeah.
Thank you, Ken.
Of course. All right, Reichert's Farm Road. It's just north of here, down White Church Road. It's a dead-end road that services residential properties. Right now, there is a culvert over a tributary to the Poestenkill that is a single lane culvert, so the road diverts down to one lane. We're proposing that the bridge be replaced this year.
Sneak behind you.
Yes.
You're okay. I apologize. Who was that?
During construction, we'll install a temporary structure adjacent to it to keep the road open and maintain traffic throughout construction.
Thank you.
Yes. The goals for this job is to have construction complete by this fall. The construction estimate is approximately $700,000 for the whole project. We're looking to advertise the project March 13th and hold the bid opening on April 3rd. Construction, we're expected to start June of this year with completion September to October 2027. We're replacing the dilapidated jack arch structure with a three-sided precast culvert on concrete footings on bedrock. The project is moving along pretty well. Right away is complete. We got temporary easement from one of the property owners. The Army Corps of Engineers permit has been acquired. DEC permit is pending, should be happen soon. And there are Verizon overhead lines that will need to be replaced for the project. And we have their cooperation on that as well. The new bridge will accommodate 2 lanes of traffic, so it will eliminate the necking down of Reichert's Farm Road. And it was built with all New York State DOT standard requirements and guide rail, so to provide vehicular safety. Does anyone have any questions?
What's the lifespan on this bridge?
It's 75-year service life. Mm-hmm. You see these last longer as long as they're maintained well, and at this location, we expect probably 100 years.
Now, did you guys work on trying to get a grant for this, right? That's something
We
you guys
did,
worked for?
yes, for Bridge New York.
How many times is that?
Joe, how many times did you submit for Bridge New York?
They did it once for us, but we've done it 5 times for the town.
Yeah. And that grant allocation is based on, need, priority. A lot of these dead end roads will get overlooked for higher priority projects. And the nice thing doing it with local funding is a lot less hoops to jump through. We can get it done quicker and faster.
Got one question back there.
Yes, will people that live on Reichert Farm Road, because I do, will we continuously be able to go up and down, or will we expect some closures at certain times, or?
So access will be maintained at all times. There might be some flaggers, out while construction vehicles are setting up the detour and just moving in and out of the work zone.
Great.
But it's no long duration closures. Yeah. Because we're gonna install a temporary structure just off to the side, pretty much keep it as a one lane road during construction, and you guys will just use
The
that.
traffic will be able to go around the construction while it's primarily being.
Yeah, exactly.
If you look where we've been cutting the trees,
Yeah.
that's where the temporary
I
lane's
kind
gonna
of
be.
figured that.
Yeah. And there'll be barriers and flashing warning lights so you guys can, see the detour at night as well.
24 hours a day, basically.
Yes.
Yeah, right?
Yes.
What's gonna be the weight limit on the temporary bridge?
It's gonna be HS20, so it's
72,000 pounds.
2,000 pounds. Yeah.
Stronger than what's there now.
Yes, exactly.
So you, DJ, you can get the big trucks up?
Yep.
Over the temporary one?
Yep.
If you need to?
Okay, yeah, no problem at all.
Yeah, we can accommodate fire
Super.
trucks and farm equipment, and everything else. Yeah. Okay, great. Thank you guys for attending. And
Sure, if you have one extra set of plans, could I grab one?
yes, of course.
If you have one.
I actually have 2 extra sets. They just don't have my business card on them.
No problem.
Yeah.
Thank you.
And thank you.
Yeah, just stage that.
And please, thank you, sir.
I don't want his head to swell, but again, I want to compliment DJ for trying 5 times, to get funding for this, so thank you, DJ.
Well, our plan is to what, bond this? A little amount? I mean, there's definitely been effort to get the grants. It'd be much better if we had a grant to offset it a little bit. I mean, my question was wondering, is it something that we should try again next year and maybe work with someone else to see if we can secure a grant? So that we don't have to bond this completely. It's a significant amount of money to be bonding for.
They applied for Bridge New York once construction started.
And we've started construction?
Like, going to about a month or two.
Well, we haven't done yet though.
But Bridge New York's not out right now either.
Right, we have to wait.
We don't even know when that's coming.
Right.
That's New York State DOT administers the Bridge New York program. My name's Sean, I'm Zachary, chief guy. DOT administers the Bridge New York program. They will wait to see what the budget in April will look like. And as of last fall, there was no determination, commitments, or anything else for what that funding for the end of the 25 into 26 would look like. Just a forewarning, again, I was open when we went after this last round. I came to DJ and to Wayne, given the cost and what we were seeing and knowing that that could be a problem, I suggested we go after it one more time because you folks had already started the preliminary design process. I felt that and got support from these 2 gentlemen, felt that usually that would be even better a project to know that we've gone through the right-of-way process, some preliminary engineering, we already had borings done, we already knew the type of project that we're gonna get. DOT usually looks at projects and looks at the risks. Also involved with, who does it serve, how many people are on the road, what are the implications of the project. They also look at risk. If you got a project with a high probability of cultural, historic resources, SHPO coordination, or problems with right-of-way, they tend to hide or pull back from that. The feds are looking for, because there's some federal funding involved with bridges, and this would have been a culvert, which is typically just 100% New York State funded. They look at projects they want, not really shovel ready, but ones they think can get through the design process within a 2-year period and get construction completed in a 30-month period. So we felt that with the preliminary design already be done, we already rooted all of that out. We thought we had a really good chance. And yet they got shot down again. I have no idea why, right? We're all shaking our head going, why do other crazy bridges get it and this one did not? I thought this had everything going for it. But for what it's worth, my only input back to you, sir, is that if you do go for Bridge New York at the end of this year, if it does come out, so there's your first if it does come out, the notifications do not show up or get announced until likely July of 2026. With that, your state-local agreement probably will not happen until January, February of 2027. Going through that design process again, we would still have to reintroduce all of the cultural, historic resources, endangered threat species, wetland delineations, the entire environmental process. Now you're looking at possibly 2028 construction, assuming that you can get all those approvals in place. Again, I'm not trying to steer one way or another, just as a town, and my advisement to you as the engineer is you need to be fully aware that that's, because I dealt with other towns, they thought they get the application in the fall, they're building the next year, and it's a 3-year out window.
I understand.
So it's a long period.
Yep.
So, and we have looked at other grant, if I may be so bold, we've looked at other grant funding, for other projects. And again, I've always, you keep your eyes open for ones that you know are in need. Because I have another township that I'm working with, and we've gone through the same process. Currently, that application period for grants has kind of closed for the season. Some of them that'll start coming out, typically in May. Sometimes through DEC, they have flooding mitigation, some other type of stuff like that. Local communities, there's a community improvement program that you have to go through your state assemblyman for. Those typically open in July. Announcements for those are typically made in the December, January mark of 2025. And again, I'm only spewing all this out, I just went through it.
No, I understand what you're saying, and it takes years, and it's taken 6 years for us to get to this point, but it's also $800,000 in a small town.
Yes,
Not an
absolutely.
insignificant amount of money.
Wholeheartedly agree. And again, I'm dealing with another town, they've got the same problem. And as a former public employee, breaks my heart. So,
And thank you very much for taking the time to go into detail and explain everything. Sure, we appreciate it.
So if there are, after this, if there are any other comments folks have, or you and the board have, certainly can get them through to DJ. He's got our contact information. Again, we've been over several times with Tom, DJ, and Wayne. We're more than happy to meet with you again, talk about whatever it is. If any of you have questions about the project, we can answer whatever your questions are.
Thank you for your professionalism.
You bet.
Thank you. We thank you both very much for taking the time to go out in this wet night and ever-changing weather conditions that we have. Thank you very much.
You're welcome.
Appreciate it.
If there are nothing further, are we okay to go?
For you guys.
We gotta sit there? Okay, we'll stay.
He's kidding.
You don't want cake?
You're free.
I got 2 more minutes?
Nice job, man. Nice job.
Having sandwiches in 20 minutes.
My name's Joe, I just put my cards on the table, and I'll just ask the question. Thank you very much. We're more than happy to help, this is great. We've been very, very excited to help the town with this. We've been excited since day one, coming out and meeting DJ the first day we were out, on site to meet him and talk about the project, and getting selected the first time through, going through the Virginia process. It's been our pleasure. Love projects like this. It's why we're here, and it's what I do, what we do. So,
Thank you. A very nice evening to you both.
great. Thank you.
I'm sorry. Excuse me.
Sorry to keep getting up here. One more question. I'm sorry I haven't been here before on this particular subject, but where's the funding for the bridge coming from? Is it just out of the town budget, or?
We're gonna do a 30-year bond.
30-year bond.
Okay, all right, thank you.
Sure.
I won't get up anymore.
It's probably the best use of bonding to do projects like this because they do last
Longer than the bond.
longer than the bond.
Thank you.
Appreciate it.
Sue makes great cake.
Good night, thank you. Okay, next item up, Dr. Hashi, we thank you very much for making it. And seriously, thank you.
Joe? Absolutely.
Great presentation.
Yeah, here, I'll get this over here. Here's what the handouts.
Can I give you a hand?
Yes, you can if you want to.
Sure.
So there's those that people can get.
Can we go this way with them?
Yeah, that would be excellent. Awesome, thank you so much. Those.
You need something for the posters, back there.
Yeah, I got it, or I can hold it, either way. Thank you very much.
Sure. Thank you. Oh, you're different.
Yeah.
Oh, okay.
He's sure around.
Yeah, me too.
Oh, so you know me.
Yeah. No, you're not.
These are perfect. These are perfect. These are perfect.
2024 and 2025?
Yeah, 2025. I got 2025, yeah, 2024.
I got 2024.
That's what we need.
Sorry, lots of data. Okay, you mind passing that?
The goal.
You got it, Don?
No. Oh, you have another point right here?
Yes, I
Pass
do.
that around.
Okay, this is all. You got it.
2024? Everybody has 2024 up here.
Only if I can have some cake.
Where's
You want it?
Yes, I do. Thank you.
You left over, huh? Excellent. Thank you.
What year do you have? 2024? Okay. Oh, we got all kinds.
I knew I showed up.
There are two, there's 2024 and January of 2025. Of the multi-page, and then there's a bunch of other ones as well.
2025.
I don't know.
Just one.
Do you have one of those?
There you go.
Yeah,
Yeah.
Thank you. 2024, and I think that's the graph.
I don't have the graph.
This is,
Hold that. I have the graph. I didn't.
We were short a couple of.
okay.
Oh.
You know?
And the bar graph here, so
Behind you.
I have this one.
I have access to graph.
Are there any answers of this?
would you?
Okay.
Sure.
I have a picture of
apologize.
that.
Yeah, it's up here as well. I'm sorry, I probably could have done this in a more organized way. This is the chaos of the ER, this makes me feel at home. It's right there. Thank you. All right, I'll introduce myself. I am Dr. Hayashi. I do work at Albany Medical Center as an emergency department physician, also an EMS physician. However, the views that I express here do not represent Albany Medical Center. I am also the medical director for Rensselaer County Bureau of Public Safety. Again, my views here and all of this stuff does not represent the views of Rensselaer County or the Rensselaer County Bureau of Public Safety. I primarily get paid through Albany Med. I do medical direction for a number of other agencies that all goes through Albany Med, and that is how I get paid. I do also get a small paycheck from the town of Colony to do medical direction for Colony EMS as well. That is just my full disclosures. And again, this also does not represent the views of town of Colony. So this is my views and my views alone. As I said, I'm an EMS physician. I've actually been a paramedic for about 20 years. I sort of got a start in EMS, pre-hospital emergency medicine care in Rensselaer County, and I love it dearly, but it has some very, very, very serious challenges with it. And I've been going around sort of doing this sort of stuff. I spent about a year and a half or so collecting a whole bunch of data and trying to see where the problems are and figure out what the solutions are, because I hate bringing up problems unless there's some solutions out there for it. Rensselaer County as a whole has many different problems in different areas. There are a few areas that have high quality EMS services. North Greenbush, Sand Lake have relatively high quality EMS services. Town of East Greenbush has a relatively high quality service, and the town of Scottsdale. City of Troy has the Troy Fire Department, which provides good EMS services. Outside of that, different areas have different problems. There are a couple areas, including the town of Poestenkill, the town of Brunswick, and the city of Rensselaer, that have no dedicated ambulances in their districts or their areas, and rely primarily on Mohawk ambulance service for service. There are other areas that have varying degrees of services, whether they be volunteer services at the what's called the EMT level, sort of a basic, we can put on splints, we can give you some oxygen, we can maybe administer an EpiPen, those sorts of things. And then many areas do not have access to paramedics or sort of the more advanced life support, where if you're critically ill, they can put you on heart monitors, put in breathing tubes, start IVs, give medications, etc. And so, again, as I said, different parts of the county have different problems. Poestenkill, due to a number of factors, has probably the most serious problem in the county, in all honesty, unfortunately. So you both lack access to ambulance services as well as paramedic services, and partly as a result of the geography of where you guys lie and the lack of cooperation and coordination with sort of other surrounding EMS services, you get incredibly delayed ambulance response times and paramedic services to your calls. In my role, I happen to be blessed in that Albany Medical Center provides me with a response vehicle and some medical equipment that I am allowed to go out and use. I am allowed to cross all these boundaries that other ambulance services, et cetera, are not allowed to, and so I get to go do the right thing for people, or try to. But the challenge is this is me going out there and trying to put, trying to fill the gap, and the gap is just way bigger than I am. And so it's a real challenge. And so I see the human results of our disastrous EMS system in the county in general, and especially, unfortunately, in various places, including the town of Poestenkill. And it's heartbreaking. It's heartbreaking. And so that's what has driven me to come out and talk about this stuff. So as I said, I sort of collected a whole bunch of data. I've managed to get it through the Rensselaer County Dispatch Center, which is about as accurate as you're going to get, and across the board is a way to sort of evenly figure out what responses look like in different areas. And so 2024, significant delays in ambulance responses. This graph, I think, probably actually displays it the best. So what this graph represents is all the calls in 2024 for EMS. And the P1 stands for priority 1 calls, which are considered the most life-threatening calls, where ambulances and fire departments, et cetera, use lights and sirens to get there as fast as they can. Right? It's considered bad enough where we need to skip through the traffic lights. And there's some degree of risk to that whenever we do that, right? So we've acknowledged that there's some risk, but we're trying to get there fast because we think that there's something serious going on. Now, is there something serious going on every time? No. But I'd say a fraction of that time there certainly is. And that's why we do that. And so what this graph represents is the percentage over here, the percentage of the number of calls where an ambulance has arrived in under that time period. In green is Sand Lake Ambulance. In blue, which is difficult to tell the difference, there's North Greenbush Ambulance. They have nearly identical sort of response times there. And you can see that they have a sort of high peak, around 50% of their calls are 10 minutes or less. Somewhere around 15% of their calls are 5 minutes or less, right? And it drops off pretty quickly after 20. Now, there are some delays here, and those delays tend to be primarily due to what are called mutual aid responses, where an ambulance has already gone out on a call in its primary district, and you have to wait for a surrounding town or a surrounding ambulance service to come and sort of take that patient. So there's a little bit of a tail to this in all of these, and I think there are ways to fix that as well. But yeah, go.
I'm sorry, I have a quick question.
Yeah.
Do you have any, this makes sense, do you have any comparisons of where Poestenkill is with, let's say Brunswick and Rensselaer, who are also in the same
sort of pickle?
as us?
I have not, so the answer is sort of. I can generate those for you. And so if you really want to look at the numbers without the graphical representation,
Yeah.
there's a hard to see sheet here. You're really gonna have to stretch your glasses
That's fine.
with
Okay.
all of the data for everywhere that I have access to data on. So this sheet, East Greenbush happens to have its own dispatch center, which I don't, the dispatch data that they produce is much more difficult to convert into something that I can analyze. So East Greenbush is left off of this.
So North Greenbush and Sand Lake are right there.
North Greenbush and Sand Lake are probably the fastest, the fastest responses in the county.
We have more of that?
Of these,
Here to go.
Yeah, can you take-
No, go, good.
so you can compare. Unfortunately, Poestenkill, I think I believe in all categories comes in, unfortunately, as the slowest ambulance responses and the slowest paramedic on scene sort of arrivals. And I think, Brunswick has the benefit of being, City of Rensselaer has the benefit of being right across the river from the city of Albany. So
Proximity.
their response times, given their proximity to Albany, I think are suboptimal and could, it's kind of mind blowing that they have the response times that they have. Brunswick also has delays in ambulance, but they happen to be a little bit closer to things, and so tend to get a little bit faster responses. But you guys have neither of those factors in your favor, and also do not have an ambulance service.
Yeah, so the two numbers I'm really looking at are the mean P1 dispatch ambulance arrival and the median P1 dispatch to ambulance arrival. Those two.
Yeah, so,
Okay.
I would certainly look at those. The other question is, there's a degree of reliability in all of this, in that, don't get me wrong, every time that somebody dials 911, there is a chance that their ambulance service is out, that they're gonna be coming from farther away, et cetera, or there's something else, going on. But the reliability of the system is how often do we have these really delayed response times? And I think, so in red here is the town of Poestenkill, which has a peak out here, 25 minutes or beyond, right? And not infrequently 35 minutes or beyond for ambulance response times. And 10%, so 1 out of every 10 times that somebody calls 911, people are waiting 37 minutes or more for an ambulance to show up. 1 out of every 10 times. So you could be the lucky, 1 or 2% here that gets an ambulance in less than 10 minutes. You might be the relatively lucky, 30% or so that gets it in 25 minutes, but you also could be the unlucky 10% that has to wait 37 minutes or more to get an ambulance. It's a long time. Sometimes it doesn't matter, but when it does matter, it means life or death. It means the difference to a lot of people. And so having it be so unreliable, I think is detrimental, and I think it's hurt people over time, and it's waiting for an even bigger event to happen. It's the reality of it. So that is the challenge that we have. And again, some of the other factors that go into this. So you have 2 other surrounding agencies that, as I said, have the fastest response times in the county. The town of North Greenbush, the town of Sand Lake, and have responses that are pretty darn good. And they're not far from the Poestenkill town line. Right? I know this has all been sort of litigated in sort of the past as far as mutual aid, but I'll just cover it again. Both of those services have gotten both legal opinions as well as sort of other considerations where their towns contribute a fair amount to their ambulance services. And so when it gets used and pulled over to another town that is not able to reciprocate those services with a paramedic level ambulance to come back, if they were to need it, they're unfortunately not willing to do that outside of cardiac arrest. They're the only times that they will cross those lines. And I'll tell you, it's not that the people working there don't want to. It's not that the people there don't want to. In fact, every time, sometimes I'm with them and they hear it and they're like, oh, I wish I could go. They're frustrated. In fact, it's so bad that there was a call in January for a choking infant who Mohawk Ambulance Service was not available for. The town of Grafton ambulance was trying to get an ambulance ready for, but couldn't. It went through several dispatches. I did, go to that call. But it took, it took 20 minutes to get an ambulance to the scene, and that's only because North Greenbush broke their rules and said this is a choking incident. I'm gonna go. That crew, though, I won't say they got in trouble, but they got talked to afterwards that's breaking their rules, and their lawyer, the lawyer for the ambulance service says you got to sort of follow the rules because you can get in trouble if you don't have a standard objective way of deciding when to go or when not to go. Fortunately, the child did okay, but it was a near miss. I mean, it could have been a lot worse. You tried holding your breath for 20 minutes. And so one of these times it's going to happen.
Can I ask you a question?
Yeah.
Does Mohawk provide mutual aid to Sand Lake and North Greenbush?
So Mohawk does not have a mutual aid agreement with North Greenbush or Sand Lake. Now,
Do they provide mutual aid?
well, it depends what you define mutual aid as.
Well, you're the experts. You tell me.
Well, so will they send an ambulance if there's not another one going? If Mohawk ambulance has an ambulance available, sure, they'll send it. They're interested in keeping their wheels spinning and doing business, etc. I don't know that I would necessarily describe that as being mutual aid, though. But some of that is sort of splitting hairs. Now, that'll be the same sort of response coming out of the city of Albany or maybe the city, the town of Brunswick, etc. But I would not call it an equivalent sort of response to what they would be providing to here.
If they would.
If they would.
Right.
If they would. And I've had discussions with them. They would, assuming that there was a fair agreement on how to fund things. So lots of challenges there. If you want to really dig into the data, I have data for 2024. These are all the calls in the town of Poestenkill. So there are 273 calls. Sort of deciphering it, I have this priority 2 and priority 1. Priority 2 calls by the dispatch information that goes out are considered relatively minor calls. Now, sometimes that changes. Sometimes the fire department gets on scene and says, oh man, this person is really sick. Other times it's the other way around. But either way, priority 2 calls are, somebody fell and needs help up, or something that's considered relatively minor. Priority 1 calls are things that are considered more severe and potentially life-threatening. And those are about 70% of the call volume in the town of Poestenkill. If Mohawk Ambulance did cover most of those calls, if you go to probably the most meaningful one, it's going to be priority 1, so P1. From dispatch to ambulance arrival, which is sort of on the back of the second page on the bottom there. And I don't have a graph for that one, I'm sorry. But the mean time, the mean time for an ambulance to arrive is 24 minutes. And you can see the distribution. It does tail off, but there's a significant number who are out at 35, 40, 45, 50 minutes, etc. Don't know that I have any more than 2024s. So I can try afterwards, I can try and get it to you.
Which one is that again? What are the B, C, D, E?
Yeah, so this is when somebody calls 911, they go through what's called emergency medical dispatch. And so what the dispatcher asks first is sort of, what's the nature of your emergency? What's your location? And then if they say, well, I'm having chest pain, the dispatcher asks some other questions. How old are you? Are you, sweaty? Do you have a cardiac history, et cetera? And then they make a determination about how life-threatening they think this is. This is a higher likelihood of being a heart attack. Let's send it, and those are usually done dispatched as a delta chest pain. Or you're a young person, this sounds more like a bruised rib, we'll make it an alpha chest pain call, right? So alpha is sort of the more minor things. Echo is the most, or E for echo is the most life-threatening sort of things, and everything else is sort of in between. If that makes sense. Yeah. Yeah, for 2024, let me make sure. Yeah, just 24 numbers. Again, the mean time is 24 minutes, and there's sort of a long tail to all this. And I just want to put a little bit of this in perspective. So this is a call that I actually went to last year in the town of Poestenkill. So this was an unfortunate accident. I can't say where exactly when. I will say it was sort of cold and rainy out, not unlike tonight, for a young woman who was in a pretty terrible motor vehicle accident. Her car ended up on fire as well. Fortunately, she was able to get out before she was seriously burned by it. But she laid in the roadway. The fire department responded and did a great job. I responded to this as well. It took me about 20 minutes or so to get there. And she was pretty critically injured, but just lying in the roadway while the fire department is sort of waiting for the ambulance to get there. They don't have anywhere else to put her, et cetera. Severe pain and again, critically injured. And it took another 15 minutes after I got there. And it again, took me 20 minutes, which is a while for me to get there. So she waited for 35 minutes in that roadway. And certainly when I got there, I started to help her, but I couldn't get her out of the rain or the cold, et cetera. And this is somebody who's, she ended up lucky and ended up surviving, but it could have gone the other way. And I'll be honest, if you guys had an agreement with North Greenbush or Sand Lake, that response time would have been about 10 minutes. And so, all these are sort of one-offs. So it really does, it has an effect out there, I think.
Can I ask you a question?
Yeah.
How much impact does the fact that Poestenkill is a large town and much of the town is pretty rural have on these response time numbers?
It definitely has some effect on it. As you get, so if you were in a city, the sort of what's considered the standard response time, right? If you were to have what's considered a good EMS system would be 9 minutes or less. There's no way that's ever going to happen in the town of Poestenkill, and I don't think anybody expects that. But I'll be honest, town of North Greenbush geography is a little bit better. They have some, their station is in the corner there. Sand Lake has some areas up in Taborton that are pretty far out there, et cetera, as well. And so I think the characteristics of the town of Sand Lake are not all that different than the characteristics of the town of Poestenkill, and they're able to do it. Okay. So I don't think it's an impossible thing. But it's got to be a, how do we get there? How do we get there? So anyways, these are all sort of some of the challenges that have been out there. And the question is any of this getting better, right? Is any of this getting better? And so I pulled the January 2024 numbers. So this is just January 2025. This is just the January 2025 numbers. And still, if anything, I think it's getting worse. Nobody has gotten there before 15 minutes, and still the peak is out there at 25 to 30 minutes. Some long delays. And if you look at the 2025 data here, Mohawk Ambulance took 14, so there were 24 calls in total, 17 of which were priority 1, so still around that 70% mark. Mohawk Ambulance took 14 of those calls, which is 58% of them. Grafton Ambulance took 9 of them. And North Greenbush again broke their rules and took that 1 call for the choking child.
Does that mean Grafton broke the rules too?
So the answer is no. You have to do what they're doing is not really mutual aid. I will say that. And Grafton does not actually have a CON for the town of Poestenkill. What a CON allows you to do is basically bill. So if they're billing patients when they transport them from the town of Poestenkill, they may not necessarily be allowed to do that, but they can come into the town and do those calls legally. The question is whether they are, they don't have a requirement to. Let's just leave it at that. Right? They're doing it because they feel like that's the right thing to do. I have had some conversations from some folks from the ambulance service in Grafton, and while they continue to want to try and help where they can, their town has put some pressure on them to maybe not do as much because they're worried that they will be over here when they should be covering their town of Grafton. And so sorting some of this out, I think, is really the right way to do it. And it's got to be a way of working with everybody else around us. It is going to be the most efficient and effective way to do it. I don't have any more of these poster boards, but I have spent a fair amount of time sort of digging into the numbers and how could we get things to work in a better way in Rensselaer County in general. So this is not just Poestenkill, yeah.
One question
Yeah.
more. This graphic here.
Yeah.
Is another, I think, important one. So when you say that a paramedic arrives 75% of the time.
Yep.
And that the other categories are no paramedic requested, not available, paramedic available that never arrives.
Yeah.
Is that to mean that 75% of the time the call goes in Poestenkill, we're not
Getting a paramedic.
right?
Yeah, correct. And I'll be honest, that 75% is the maximum. So when I calculate this data, I don't have access to which Mohawk ambulance units are paramedic level and which ones are EMT level.
You don't have that.
I don't have that information. So in these calculations, I assume that all Mohawk ambulances that respond anywhere are at the paramedic level.
But we know Mohawk.
We know that's not true. Right. It could be 50% of them, could be 80% of them. I don't really know. And so the most you get a paramedic is 75% of the time. It could be lower. It definitely is lower than that. I don't know how much lower than that it is.
Thank you.
So I spent a fair amount of time sort of looking at different ways of how could we improve the system. And I think in general, and this is sort of Rensselaer County, many different problems, many different individual towns, et cetera, with different needs, et cetera. But sharing services, I think, is the way to go. And I've sort of gone through this in different ways. And I've done a whole bunch of different plans. If the town of Brunswick and the town of Poestenkill and the town of Sand Lake were to do an EMS service, how much would it cost each of them? How much could they collect in billing revenue, right? So that people pay into insurance for health insurance for a reason. And so some of that money, if you take an ambulance ride, can go to support, having an ambulance, et cetera. So I figured out how much the current EMS services, so Sand Lake Ambulance or North Greenbush Ambulance or Hoosick Valley Rescue, which is in the town of Schaghticoke, how much they make on billing revenue per call. It comes out to about $450 on average across, all of their calls. And then I can figure out how much, based on the call volume that is in the town of Poestenkill, the town of North Greenbush, the town of Sand Lake, et cetera, how much each of those agencies roughly would be able to get in billing revenue. And if you take that out of the total cost of what it costs for an ambulance, which is somewhere between $850,000 to $900,000 for a paramedic level ambulance per year. If you take that out of that, then what's left over needs to be funded somehow. And in general, that is through municipal funding. If people are sharing services between towns, so for example, the town of Poestenkill were to share a service with the town of Sand Lake, the fairest way that I see doing that in general is to base it on total market value in each town. I thought about doing it population based. I'm not sure that quite works in a fair way, and it undervalues a little bit of some of the ability of some places to pay versus others. I thought about doing it based on call volume. In some places of the county where they have things like nursing homes or urgent cares, that increases the call volume significantly, and I think puts a little bit of undue burden on those areas if you do it based on call volume. In the end, I think total market value for properties in each town is sort of the way to go. And that allows me to make a calculation about how much per $1,000 of total market value people would pay. And so I've done all these different plans, and that's what this one looks like. These are the only ones that involve Poestenkill. You guys being in the middle of the county, they'll have lots of options of people to work with. So that's the one benefit that you do have. And so I have a different book with sort of all the drawings of what these groupings of services would look like. But basically, on the left side here, you can see what different towns are currently paying in for their services and how much they're paying per thousand, right? So some places like the town of Grafton is paying, and I'll say one more thing about these. These are 2023 numbers. I am in the midst of doing all the calculations for 2024. It's a lot of work though, and I'm not quite there yet. But you can see sort of what they pay. So for example, the town of Grafton paid $30,500, which is 10 cents per thousand in their town. On the high end of things, the town of Schaghticoke is paying 71 cents per thousand. Right? So you can do all those sort of calculations. On average across the county, if you take everybody, it's basically 24 cents per thousand. which comes out to about $72 a year for a $300,000 house, is what, on average. And that includes places like Brunswick where they're not paying anything for an ambulance service, and places like Schaghticoke where they're paying a lot for an ambulance service. So that's sort of the average. If you look at all these different plans, it depends on how many different towns you get to sort of come together and work together. Some of these are more beneficial for the town of Poestenkill. Some of them are less beneficial. If I could get every town in the outside of the city of Troy and Rensselaer County to come together, we could have 13 paramedic level ambulances for basically 43 cents per thousand, which comes out to be $128 a year, which I think would be a pretty good system. But to get that to happen, obviously, it's going to take a lot more than we just talking here tonight. But those are the sorts of things that I'm out there trying to do. And the other benefit of this is that you can look at this from your own town's perspective and see which ones sort of benefit you the most. And then these are certainly not offers, right? So nobody's putting this on the table, but I have had conversations again with Sand Lake Ambulance, North Greenbush Ambulance about their willingness to participate in something like this for the town of Poestenkill. And both of them would like to do something, would like to help, but it's going to have to be a sort of fair thing. And they have other considerations currently, right? Because each of those ambulance services are doing pretty good. They would like to extend and be able to help. What they do not want to do is degrade the services that they currently have in their own towns.
Take our 37 and they're 10 in that group.
Yeah, right. So, and this is again is not a formal offer. You guys would have to have a more formal discussion. I have heard what is essentially on the table from the town of Sand Lake is that somewhere in the neighborhood of $240,000, they would be able to put on an extra half an ambulance to be able to cover, they think, both towns. I think that would be more than enough coverage, in all honesty. I think you guys would get great responses out of that. And the agreement from North Greenbush is that if town of Poestenkill were to do that with Sand Lake, then North Greenbush would then consider a mutual aid to come into the town of Poestenkill. I think that you guys would have fantastic coverage then. I think both of those organizations are high quality organizations. And if they agree to do something like this, would provide high quality care and timely responses. Again, I don't live in the town of Poestenkill. In the end, that's up to the citizens about whether they think something like that would be worth it. And there are other options here as well. Brunswick is currently also struggling with this very similar situation. I've had conversations about which direction they want to go with things. Working with them may be an option. The challenge with doing something like that is that they don't have something already established. And so, yes, it might be easy to jump on with them, but whatever happens there is going to have to sort of develop, and it may develop well, or it may not develop quite as well.
In a possible agreement with Sand Lake and North Greenbush, they would still house their ambulances in their own stations, which are fairly close to Poestenkill. But there would be no additional ambulances physically in Poestenkill in that kind of agreement.
Yeah, so my understanding is currently what is on the table would be correct. An extra ambulance during the day, and they would come to Poestenkill at all hours, but it would allow them to staff up during the day to be able to cover their town. That would be out of the Sand Lake station. Now, what I will say is that is a start, in my mind, that is a starting point, not necessarily an ending point, right? And I think that if calls were to go up, or it were to become sort of feasible to put a station over here for an ambulance to be here, at least that extra ambulance during the day could be stationed over here or something. I think all those things are possible. I can't speak for Sand Lake specifically about what they would eventually be willing to do or whatnot, but
now in that scenario, would they be still providing mutual aid, or would they be the primary service?
They will be the primary service. So for them to come into the town of Poestenkill, they will have to have a certificate of need for the town of Poestenkill. And so they will be your primary service, basically.
And then will Mohawk also be able to answer calls if they are in the area?
Yeah, I mean, there's nothing. So Mohawk Ambulance Service has a certificate of need for all of Rensselaer County. Certainly, nobody is going to say, geez, if you're driving by a bad accident or whatnot, like, yeah, stop and do the right thing. None of these, both of these agencies, North Greenbush and Sand Lake, are not about trying to edge out the competition or anything. They're just about trying to take care of people. And so I think there would be nothing to stop Mohawk from doing that if they're here.
It's my understanding that Brunswick has literally just passed given the supervisor the ability to sign a municipal CON. But I'm not quite sure I understand all that. What is that process? Do you understand the difference between the CON and a mutual CON?
Yes. So let me go into a little bit about that. So CON, Certificate of Need, it basically allows an ambulance to operate and bill for ambulance services in a certain area. There are 2 services that have a Certificate of Need for all of Rensselaer County, including the town of Poestenkill. So Mohawk Ambulance Service, and then it used to be Empire Ambulance Service, but they have sold their Certificate of Need to Ambulance, which primarily services the town of, the city of Cohoes, and does some inter-facility transports between Glens Falls Hospital, Saratoga Hospital, et cetera, and other places. And so they have not thus far done a whole lot of activity in Rensselaer County. So really, essentially right now, it's just Mohawk Ambulance has a Certificate of Need for all of Rensselaer County, including Brunswick, including town of Poestenkill, et cetera. That is a regular Certificate of Need. What towns and or cities are able to do, or even counties are able to do, is they can get what's called a municipal Certificate of Need. And so this is saying that these ambulance services may already have it, but we want to be able to control who can operate specifically in our town. And so if you apply for a municipal CON, there was a legal dispute about this, and in the end, basically what was decided is that if the town applies for a municipal CON, it will be granted, period. Usually takes about 30 days or so. There's a fair amount of paperwork involved, et cetera. The caveats that come with it is that any billing revenue that's generated from an ambulance service using a municipal CON is the property of the town, right? So how you do that, so the town may collect that money and either give it back to the agency to fund it, or maybe they just fund the ambulance agency and they collect whatever funds and use that to for other things in the town. However that works, but the billing revenue for a municipal CON, it belongs to the town. The other thing is that the ambulance has to basically say it's serving the town of Poestenkill in this case, somewhere on it. There has to be an ambulance that says that. Outside of that, the town can either do their own municipal ambulance service, they can contract somebody else to do that ambulance service. And I think the idea in the town of Brunswick is to contract with somebody else to do that ambulance service. My understanding is that they are planning on putting it up for a RFP and seeing sort of what different people's, different agencies' interest in sort of doing it there. But there's also some other conversations about what the best thing to do in the town of Brunswick is, just like we're having a conversation about the best thing to do in Brunswick.
Not to get in the weeds on that, but is that an issue where, so like let's just say Brunswick currently has a CON with Mohawk, right?
Mohawk has a CON.
That's their CON.
Correct.
Is it the likely process as opposed to, and this is where I'm confused, right? Their process, I think, is to get this municipal CON and then make the decision, as opposed to asking Mohawk to give them back their CON. Is that fair?
So they do not, because Mohawk Ambulance has, even if Mohawk were to have a regular CON for the town of Brunswick, the town of Brunswick has no control over that CON. Right. And so they can't ask for it back. You could have a hearing to say, well, Mohawk is not meeting the need out there and shouldn't have it anymore. And there would be a big whole public debate about that. And for the most part, the state is very hesitant to take back CONs unless you really have not done anything at all in an area. And so other people can apply for regular CONs. For example, let's say the town of North Greenbush wanted to go into the town of Brunswick. They could apply for a regular CON. It's a long and drawn out process though, in that there's public debates about whether there's a need in that area, et cetera. Many commercial services oftentimes will oppose that just out of principle. And it would be sort of this long drawn out process to get it. Whereas the difference with that is that a municipal CON, it is the town that has decided that there's a need here and we're just going to do something about it.
So procedurally, it's a more controllable process. to do the
Correct.
municipal. Thank you, appreciate that.
Yes.
We have a chart here about dispatch to ambulance back in service. Does
Yep.
that mean when they come back from the hospitals?
Yes, so I will say one thing about the data, especially for Poestenkill for being back in service, that many times on the dispatch information for the town of Poestenkill, Mohawk, once they've hit the hospital, the dispatcher doesn't hear back from them when they're really back in service. And so
Okay.
that the data, especially for the town of Poestenkill, I think is highly unreliable in that regard.
Well, in that case, I've heard that the ambulances are sitting, all ambulances are sitting in the hospitals for sometimes extended periods of
Mhm.
time.
Mhm.
How much of an impact does that have on all the ambulance services?
So it definitely has an impact. And, we've seen the pictures and feel it. And sometimes there are these egregious cases where people are waiting more than an hour, sometimes more than 2 hours. They're relatively rare, but obviously when you're sitting there for 2 hours, it's like, very frustrating. What I will say is that the towns of Sand Lake and the towns of North Greenbush are subject to the exact same ambulance wait times that we are here, and they're still able to do this. So I suspect that as far as the town of Poestenkill specifically goes, I'm not sure that it's had a significant effect.
I'm just thinking in terms of all services, because if you're taking a percentage of amount of service,
Mhm.
that's fewer ambulances for us.
It certainly is. It certainly is. It has some effect. There's no doubt about it. The healthcare system is broken. I don't think anybody in this room would argue against that. And it's multifactorial. So yes, the ambulance is back up in the ER. The ER is backed up because they're overcrowded. The part of the reason that the ER is overcrowded is because they have a bunch of patients who they've decided are sick enough to need, inpatient admission. They need IV antibiotics or whatever. But they're stuck down in the ER because the rest of the hospital's filled up. The rest of the hospital's filled up partly because of the aging population, and there's just people are sicker and have more needs. And then the other part of that, though, is that it's difficult to get people from upstairs in the hospital out to the nursing home or to acute rehab or whatever else out there. And so even though they're ready for discharge, we can't get them out of the hospital because we have no place for them to safely go. And so the whole system is this big cog, and it is jammed up bad. There's no doubt about that. But I guess what I'll say is that yes, hospital wait times for ambulances contribute, I think, a little bit to these problems. But I think both that it's not the major contributor, especially here, and I also would say that whether it's a contributor or not, I don't see it getting better anytime soon. And so I think that we just have to take care of our people.
I just heard a story of someone who in Albany got hurt and needed surgery and got into the hospital in 15 minutes and waited for 19 hours in the hallway before he went in for surgery.
So
that just seems just unbelievable to me.
It depends what that surgery is for. So Albany Medical Center is a very
well, it's a triage thing, right?
Yeah, it's partly a triage thing. It depends a little bit on how urgent that surgery is. It depends on how sick other people are, et cetera. So there are cases that get bumped around, and we try and balance. Everybody's trying to do the right thing for people, but we do have limited resources, just like everything else. And so we're limited on beds. Where I guess we have to use hallway beds. Nobody likes it, and it's I feel bad when I walk by them 20 times and they're still just sitting there staring at us. But we only have so many ORs, we only have so many surgeons, we only have so many anesthesiologists, and so we have to make hard decisions every day about, do we think this person can safely wait for a little while we take care of somebody else who we think will die if they don't get the surgery. So it's the healthcare system. So I guess you guys have all the data here. You can sort of look through it. You can look through the different plans. I'm happy to answer questions on it. I really think that working collaboratively with other agencies, towns, et cetera, is the way to improve things across the board.
Where can we get a listing of what the plans include?
Yeah, so I apologize. I had a binder all prepared, but I do have a copy of the whole financial analysis here.
Tom has it. You can email it to everybody if you want to.
Yeah, well, if Dr. was gracious enough to supply it, I have a copy upstairs. I'd be more than happy to give you your email address. I can send the whole item to you.
Okay.
For your,
That's fine.
review at your convenience.
Yeah, so it looks like this, right? So you
Yeah.
just draw,
Yeah, yeah.
you know, and sort of look at all the analysis. And again, this is based on 2023 data, although I suspect when I finish the 2024 thing, it'll look basically the same.
One thing I wasn't clear on when I looked at all your maps that you
Yeah.
had of the different plans, is
Yep.
there's no text to describe in advance what these plans actually meant. I didn't really understand what your big red line was compared to.
Okay.
What does that mean?
Perfect. So this is a way of different areas of the county sort of regionalizing, if you will, right? So in the end, you know, it would be my dream for a couple of larger agencies in Rensselaer County to sort of come to be. And that could be a northern Rensselaer County EMS and a southern Rensselaer County EMS. It could be a, you know, southwestern Rensselaer County and.
So you're basically just grouping different areas to see what this one would.
Correct, and doing a financial analysis to see how financially feasible it is or is not.
I know at the last meeting you talked about the 22 care corridor too, and that's,
I know, I'm trying. They're a bit of a challenge. I'm hopeful that if I can shore up the rest of the county, like if I could get the rest of the county to start to work together towards something like this, that I could then extend it outwards to the 22 corridor. The number, as soon as you start including, you know, unfortunately, many of those towns in the 22 corridor, in some of these plans, the amount goes up that many agencies are paying, which makes it sort of, I think, untenable politically to sort of raise somebody else's taxes to be able to include a less populated area. But, yeah.
When you put the chart up, the picture of the of the car accident.
Yeah.
I'm an RN, and it's wonderful we have our first responders, and they were able to get her out of the car.
Yeah.
But as you were saying, if you had, and you know, I know what they're, you know, like you were saying, they're advanced EMTs,
Yeah.
but if you have the paramedic on site, I mean, just by looking at that, and there's so many things that, you know, if she had a broken rib, she could have a lacerated liver, she could have a punctured lung, she could have a flailed chest. There's a lot of things that if you don't have the proper person,
Correct.
there's going to be a lot more that could possibly go wrong with her when you have to take her out of that car.
100%. It's getting the right person there at the right time, and having transportation available. If you can get those three things together, you have a good pre-hospital, you know, emergency medical system. And I think it's possible. I think it, you know, it's going to take a little bit of hard work, and it's going to have to take a dedication from the town in a financial way to make that happen. But that's not for me to decide in the end. But I just want to present you guys with the data and the information, and tell you that when I go to these things, it means something. It really does. And I've seen people have bad. I haven't talked about the bad outcomes here, but there have been bad outcomes in the town of Poestenkill. I think as a result of delays.
well, I'll say we appreciate you putting this all together for us.
Yes,
Yeah.
yes.
Seriously.
Always appreciate you taking the time to address this.
Yeah, absolutely.
Thank you very much.
Thank you for allowing me to speak. And if anybody has questions, yeah.
No, I want to thank you for the February 20th meeting that you put on for us. It was very, very informative. And there was a number of things that I took note of, one of which was, and this is a pretty close paraphrase, we need our elected leaders to get together and be committed to control this, but even more, the people need to become involved. I'm asking your opinion as to our local governance putting together some kind of a drive to increase the public awareness of what we're trying to do to solve this problem and to provide information readily available to the public so that they can see that there is motion going forward, because we obviously do need to solve this problem.
I appreciate you saying that, and that honestly is 100% what needs to happen next. Is sort of, and you know, obviously me speaking tonight is sort of part of that, and but I need, you know, everybody to go out there. And my understanding, I'm not a big social media person. My understanding is that there's been a lot of conversation on social media, which I think is great. And you know, the one thing that I do want to make sure of, though, that the information is accurate. I don't want people, you know, selling it too far in one direction or the other. But yes, I would love to go out there and talk more. I'd love to have other people sort of discuss it. And I'd love to arm you guys with the facts so you know what the reality is and what we're doing.
You're already doing that, and as you can see, we're recording this event this evening, and I would like to solicit your opinion on something else. Seems up. We do have some editors here who are putting out a quarterly newsletter, and I would like you to see a relatively unique feature about this, in that this newsletter has QR codes.
Yeah.
And what this newsletter does is just give the general public the headlines. If they want to be brief, they can just read the summary here. If they want to see the entirety, they can click onto this.
Yeah.
So
yeah, absolutely.
I just wanted to get your opinion to see if you had anything that you wanted to add to this. If you would like to see our elected officials, and I want to thank Mr. Bazisi for giving support to this newsletter. I would like your comments as to how we might coordinate through our elected officials to potentially use our quarterly newsletter. You can have that.
Perfect, thank you.
To use our quarterly newsletter and give people the option of getting some really thorough coverage.
Yeah, I think that's a fantastic option. And again, I would public relations. I'm a doctor, so I guess I do some degree of public relations, but it's not my specialty. But I would absolutely love some help in sort of navigating how to sort of sell this to the public, etc. And I am happy to supply all the data, especially in a post and kill sort of focused way. I would love to team up with some folks and put out something that's really robust and make a good argument for our case.
Thank you.
Speaking of Frank, we started this like back in 2016. We had an ambulance committee that we had put together, and we got a lot of that data. And we had met at the firehouse, and we had people come in and do their public comments, just like we did for the comprehensive plan. The people came in and did comments. That's something that we should probably do again, is have the public's comments and say, here's your options. What do you want to see happen? Because this could be your life.
Yeah.
And I don't want to break it down to that, but it's true, one way or the other. So.
Yeah, I would love to support that. I've been invited out to the Center of Brunswick Fire Department to have another sort of similar thing to what I had at the Poestenkill Fire Hall. But I'm happy to have sort of more meetings and allow people to sort of ask questions after they've had some time to digest the information.
I'm Marcy, and I'm part of the fire company, so I do the first responding with everybody. I was part of the first round of the ambulance situation that went down, and why that went down the way it did is we didn't have a plan. You know what I mean? And I think by having a plan first and getting some information first and then presenting it and making sure it's presented to everybody in Poestenkill, and I mean in the outskirts, because the other problem that showed, if you looked at those numbers that voted at that ambulance vote, we did not represent any part, maybe 10% of the residents in Poestenkill, and I think that's where the other disservice is. This needs to be reached out to absolutely everybody before it goes down for a vote, and to make sure everybody has their questions answered and asked. Thank you.
Agreed. Awesome.
And that might be where you might come in, that, like you said, if you invite the public, and if they have questions, then you would be the good person to answer those questions for them.
Absolutely. Yeah, I'm happy to stand up, and obviously I'll talk about this all day. Thank you guys for entertaining my whims tonight. No, I appreciate you guys listening to this, and I welcome questions and further dialogue, and I'm hopeful that we can make some positive changes. Thank you guys.
Thank you.
Thank you.
Appreciate your time. It's a pleasure.
Oh, yeah. This one, yeah, we can do that. This one. There you go. Always, yeah, absolutely. Yeah. Oh, yeah. My pleasure. Thank you.
like I said earlier, if you wish to get a copy, please give me your email address, and I'd be more than happy to start the email distribution tomorrow.
Okay.
Okay? Please leave your email.
Can we, post that to the website?
You can, yes, sir. Without question.
Okay.
We should update the website too, because it's not quite up to date.
Right, but there's probably a way we can just get that on there.
Yeah,
Have a
no, you
link
put it
to it.
up there. They're not update, like big update, this is
No.
like
I
town
agree.
meetings and things like that. Just,
I agree.
Okay. Next item up on tonight's agenda is the payment of the bills.
Okay.
Please, if you would, David.
Let's see, I move that we pay the ARPA bills of $22,977.98.
I'll second.
Okay, thank you very much. All those in,
You gotta move quick.
Yeah.
Because otherwise Tom will get it.
I know.
excuse me. Okay, all those in favor of paying the ARPA requirement tonight at 22,977.98?
Aye.
Aye.
Anyone opposed? Was it? June unfortunately is absent. She's doing well.
I move that we pay the general bills of $4,090.50.
I'll second.
You're too slow.
No, it's good.
You're very nice. Thank you very much, Frank. All those in favor of paying the general of $4,090.50?
Aye.
Anyone opposed? Anyone abstaining?
I move that we pay the highway bills of $5,496.01.
I'll second.
Thank you, Eric.
Good, quick.
Right there. All those in favor?
Aye.
Anyone opposed? Anyone abstaining?
I move that we pay the water one bills of $80,541.59.
Thank you, Frank. All those in favor?
Aye.
Anyone opposed? Anyone abstaining?
And I move that we pay $42,819.34 for water two. Once the detailed information on one of the bills comes in, and Tom will send it to all of us for approval.
Thank you very much, David. I'll second that motion. All those in favor? And Eric, Ian, am I saying this right, the modified? How do we properly?
Is this the issue we spoke about earlier?
No, this is about, well, this is about paying water two, waiting for the information to come back from the Burge detailing the charges they put into this bill.
They already sent us an
They sent us
invoice,
a
but
bill.
didn't have enough detail.
I couldn't see what they were spending the money on. Like there was just blocks, like we were gonna,
When will they be providing that information?
Hopefully tomorrow or the latest by Monday, but I called him tonight prior to the meeting and asked Ron that he would send it.
Okay, I mean, it is problematic that we're approving a bill that we're really not sure what we're paying for.
and I'd rather not that.
Yeah, I think if we don't, if it's contingent upon, a detailed accounting of what it is, I don't think it's prudent to act without seeing what we're paying for.
Okay, now
So,
that was not the entire part of the water two bills. Is that correct, Tom?
I thought it was.
It is the whole thing?
That's
Okay.
okay.
All right, then I withdraw my motion.
Thank you very much. Okay. David, thank you. Board, thank you very much. And thank you for your input.
Tom, you never ordered the bills at the start of the meeting, or not ordering bills?
No, we didn't.
We've never really, okay, well, the audit committee has reviewed the bills and found them sufficient to be paid with one exception.
With my exception.
Are you happy now, Sue?
Yes.
Okay, next item up we have is the public comment session.
I would like to ask if there is a recommendation that the town board would consider selecting and appointing an ambulance commission to begin the research necessary to start the process here in an official fashion, and I would like to hear your collective response as to the suggestion for creating an ambulance commission.
Well,
I would like, okay,
I'm just thankful that we have that data, because there's been a lot of, like you said, Beth, there's been a lot of stuff going around, and you just after a while don't know what's true and what's not. And just starting with the good, bad, and of everything, and real hard facts makes it easier to look at and make a decision. So I'm just thankful for that.
Well, I think that the town board is capable of starting discussions with North Greenbush and Sand Lake to see if we can figure something out. I think that the fire company with their first responders are more expert on this than any of us, and I think they should be involved in that. I wouldn't mind hearing their opinion of what we heard tonight at some point. Doesn't have to be tonight. But I think improving ambulance service for a relatively modest cost per household is a very good idea. I think he has put in an enormous amount of work into this, and data is data, and his data show that we have a problem.
Yeah,
It's never gonna be perfect,
I mean,
but it'll be better. It could be better.
I don't know what's the process by which we do that, but I think, exactly what David says, start having those conversations and certainly include the public and certainly include the fire department. And, we have first responders that do a great job. We don't want to put them in a situation where they're at a scene waiting that long and in a tough spot. So however we slice and dice it, I'm happy to help out any way I can, or a subset of the town board to start having those conversations, but probably get the ball rolling.
I too would like to hear from the fire department, and we will converse with Sand Lake, and we will converse with North Greenbush and report back.
Thank you.
Is the fire department willing to talk with us on this? Get your opinion, get your thoughts?
Yes.
Of course.
Yeah, cool.
It's always best to ask and then presume, and not put anybody on the spot. That's why I like to ask.
And realistically, you're doing the job right now, so you're the most knowledgeable group.
Thank you very much, one and all. Anything else in public comment? Please, thank you.
My name's David, member of the fire company. The shared service is a great way to start. Is it an end-all, be-all, fix it? Probably not, but it's something to get started. And who's to say in 10 years that the town will have the resources and the tax base to start their own ambulance down the road? I think this is a great beginning, and it's going to do nothing but benefit the people of the town, and it's going to fix a lot of the mutual aid problems and everything. Not that it's our problem as a town, but I think this is a great start. Either North Greenbush or Sand Lake, whatever you guys can determine to be the better of the two, the best deal, and what will benefit the taxpayers. But the shared service is a hell of a way to start. So.
Thank you, Dave. Nicole, please.
I just hope that, being on this the first time around, that we could have done this before. I just hope that we do this time, that we really do consider doing the shared services with Sand Lake or with North Greenbush.
Or maybe even all three.
All
three together.
all three, yes. But I mean, let's not get to where, yes, we're gonna do it, or no, we're not gonna do it. I mean, you can see by the doctor's data that we waited, and now look where we are. So we can't just, let's say, yeah, we'll talk about this, and then it doesn't go anywhere again. So, I mean, we really have to do something.
Thank you.
Can I ask Ian a question?
David, please.
Are we required to do a public referendum for this type of thing, or could the town board make a decision?
For shared services, no,
Yes.
we wouldn't have to do a public referendum.
Don't have to. Okay, thank you.
Anyone else? Do I have?
One more.
Excuse me, sir, I was.
Sorry, look down, so raise my hand, sorry. Rich D, Rosberg Road. I was gonna say, I very much appreciate Doc coming. I miss Poestenkill, very much appreciate it. Full disclosure, I just moved in Poestenkill a couple years ago, coming from Maple Park. I'm a 13-year member, Maple Park EMT firefighter. There's a huge difference moving into this town from where I was in response and the apprehension to have service. It's getting worse. It's only going to get worse, just like Doc said. Even the departments close to us who have ambulances, their members are aging. They are not being replaced by new members. We need to be selfish and move, because we're not going to have an option soon. The county, Doc, I want to put you on the spot, the county hasn't clearly decided to take the leadership role here. We need to be selfish and move, because it's going to get worse. Even when we have a plan, if we do shared service, those around us, they have problems. Mohawk can't staff. They can't get EMTs, paramedics. It's only going to get worse. You got to move. Can't. Much like the lady in front talking about just talk. We have to have action. So I love to hear a timeline. So you promise to get back to us about conversations. I know people only be back, but just before people talk, it doesn't happen. It's got to happen. It's going to get worse. It's happening fast.
Thank you. Anyone else? All right, do I have a motion to adjourn?
Sure.
Thank you, David. I'll second. All those in favor of adjournment? Anyone opposed? Again, I thank you, one and all, for coming tonight, for your input. Doctor, thank you very much for your time and your information.
Don't forget the other buddy.
Appreciate it. Wait, thank you for sticking around.
Somewhere.